topic is oral eplerenone for acute central serous chorioretinopathy by Dr. Tanmay. Yes.
Good afternoon. Psychological stress, type A personality, predominantly male gender, they presenting in their 20 to 50 years of age with central distortion of vision, micropsia, metamorphopsia, and reduced contrast sensitivity. Yes, I, Dr. Tanmaya, would like to present this effects of oral eplerenone on one of the most important differential diagnosis of the above mentioned symptoms, that is acute serous chorioretinopathy. So introducing to the topic, it's a chorioretinal disease which is characterized by serious detachment of the neurosensory retina and or the retinal pigment epithelium. It is usually a self-remitting course with reabsorption of fluid, and around 90 to 95% of the time, the visual acuity returns to normal. But some patients continue to have this blurring of vision even after the resorption of fluid. The pathogenesis is multifactorial, which includes choroidal vascular dysregulation. CSER has also been demonstrated with increased choroidal thickness. There are various studies which shows the involvement of mineralocorticoid receptors in the development of the CSER. So what are these? There is increased choroidal vasodilatation and leakage which has been noted following the activation of choroidal MR in rat animal models, and this phenomenon has shown to be inhibited by the use of NR antagonists. There are also many studies which has showed the effect of eplerenone in both chronic and acute CSER patients. Acute CSER usually does not require any treatment, but the persistent neurosensory detachment and its persistence for a longer duration of time can lead to irreversible changes in the level of photoreceptors and retinal pigment epithelium, leading to permanent visual disturbances and visual loss. Hence, we need a safe and an effective treatment for the faster recovery and resolution of subretinal fluid for optimum visual recovery. This is a prospective interventional studies wherein the patients who are diagnosed with first episode of acute CSER with a duration of less than 3 months have been included. Chronic CSER along with any choroidal neovascular membrane have been excluded. All the patients underwent visual acuity measurement, SDOCT at baseline, first month and second month and third month. Oral eplerenone 25 mg twice daily was started after physician's clearance till complete resolution of the SRF or up till 3 months. Renal parameters such as serum creatinine and serum electrolytes were constantly measured, and patients were monitored at baseline, first month and the third month. Results were tabulated in Excel and analyzed by SPSS software. So comprehending the results, 25 eyes of 24 patients were included with the gender being within 45 to 50 years of age, with gender preponderance of male in wherein it was seen in 66.66% of the individual, and the mean duration of symptoms lasted for about 15 days. We are comparing two parameters, visual acuity and the SRF values. Visual acuity was 612 and improving at more in 68% of the individuals at baseline. But at the first month, it showed 84% of the improvement, and by the end of 3 months, 92% showed improvement. 68 to 36, 6 by 18 to 6 by 36 of visual acuity was present in 28% of the people at the baseline, and this significantly reduced to 16% by the end of a month, which shows that there was improvement in the visual acuity. 660 and less were present in 4% of the people at baseline, and none of them are present by the end of 1 month. SRF reduction was and about 92% of the people by the end of 3 months, and complete resolution was seen in 64% of the people at the end of 1 month and 92% of the people by the end of 3 months. Now comparing the SDOCT, which was taken at the baseline and after 1 month, there is in all these 5 patients there is significant improvement in the neurosensory. There is significant reduction in the subretinal fluid, which can be significantly noted after 1 month following the oral eplerenone therapy 25 mg. This is the comparative pictures which is taken at the baseline, first month and after 3 months. The A, B, C, D, these patients have shown significant improvement in the reduction of the subretinal fluid, but you can see that in the even and the E2 patient, there is improvement in the pigment epithelial detachment also. The activity of mineralocorticoid receptor has been described in rats and humans in choroidopathy. According to Sunex et al., MR antagonist eplerenone has been shown to reduce SRF and improve the visual acuity in acute CSCR patients. Like our study, Venkatesh R. et al. Showed that there is complete resolution of SRF in 45, 55, and 65% of the people in the first, second, and third month respectively. There is significant improvement in visual acuity up to 6.6, which was noted in 92 people of the patient, which was similarly told by Zuraki et al. Also. So oral eplerenone is safe and effective by achieving faster anatomical and functional outcome in acute CSCR patients. These are my references. Thank you.
Yeah, very good presentation, Dr. Tanmay. My question is, you mentioned about the choroid thickness also, no? It's going to have an effect. What was the average reduction in the thickness measurement?
No, ma'am,
pre and the
we
post?
have not considered the choroidal thickness into the action, but we have compared only two parameters, ma'am, visual acuity and the subretinal fluid, based on the SDOCT pictures.
Yeah, I mean, I would have preferred to do that also.
Yes, ma'am.
Because the drug action and all what you were mentioning.
Yes, ma'am.
So we can compare that also as well.
Yes, ma'am. Actually, we have taken 56 people into 56 eyes have been taken into consideration, but only 25 eyes have been reported. I mean, the analysis was done. But for the next 25, we would like to improve and more a randomized control study could be adopted is what we prefer.
And also you have to compare the visual acuity improvement in the cases which are not given the eplerenone. Because,
Yes.
because comparative study, because 3 months after any CSR can resolve most of it.
Yes, sir.
In our clinical
Yeah,
experience.
that was the main topic, criteria, sir. Within 3 to 4 months, the acute CSCR episode will anyway come down. But the longer we prolong, the neurosensory detachment will cause disruption in the photoreceptor layer. So there will be permanent visual loss.
So you started the treatment around and what point of time? 3 months time? Before 3 months?
No, sir. Immediately when we when the patient came, when we diagnosed on the
because you have to have a control arm of not treating those patients.
yes, sir.
And comparing the two.
Yes, sir, yes.
outcome. And but the studies internationally, I've just gone to the American Academy
Yes.
literature. They're saying that eplerenone has been found to be not useful. You know, previously there were anecdotal reports of success with that.
Yes, sir.
But presently, now it has been stopped, not been suggested.
Sure.
What is your opinion on that?
There are very majority of. There are studies which show that there is improvement, like this study and many other studies at Zuraki et al. And all.
Basically, judges are of the opinion that as CSR is a self-limiting disease, to establish the fact that eplerenone is better than observation, you should have a control arm
Yes, sir.
telling that this arm is doing better than the non-interventional arm.
Sure.
Basically,
And also then you should also compare the visual acuity status and other parameters of vision
Yes.
between the two arms. Whether the use of eplerenone is anyway superior as far as the visual function is concerned between the two groups.
Maybe the more
With or
contrast.
without?
Sure, sir.
basically eplerenone can be used only in case of chronic CSR, that is non-resistant to any therapy. You
Yes,
have to
sir.
use.
Actually, more studies are present when in chronic CSCR. In acute CSCR, it is very less number of studies have been made. Thank you.
Yeah.
Thank you.
Thank you, sir.
The next,